Why did you have to do that to them? Okay, well, okay, well.
Howdy, folks. Happy 2024. Sorry for going quiet towards the end of the year. I was abroad and things were just generally busy. I was hoping to get out another video, but it just didn't work out in the end. So yeah, apologies for that, and I really hope you enjoyed the holiday season. I wanted to talk about Kyle Kulinski and his views on transgender children. I'm using Kyle as a sort of case study, but you can apply these arguments to pretty much the whole of the left, because they all say the same things.
I'm going to try to steelman the rights argument for a second. So they say, look, for kids, there's this thing that's like a social contagion, which is it becomes like a fad. It becomes popular to try to be trans. And since that's the case, you're going to get like false positives where people are following the fad, the trend, they want to be trans, and they end up doing things that are like irreversible. And so, that's why you effectively want to ban it for young people, or at least wait until a certain line for them to decide.
Wow, good job steelmanning the rights position. Except that was completely pathetic. The whole debate around whether it's a social contagion or not is not the reason they want it banned. The reason why so many on the right want to ban it is because a child can't consent. It doesn't matter why they want to transition, whether by social contagion or some other reason, it's that they can't consent to it. And Kyle should know this, because he says later on in the video he wouldn't want children doing bottom surgery because they can't consent to it. No social contagion needed.
Now, having looked into what actually happens with trans youth, it's the right doesn't really understand what happens in terms of the healthcare that trans people can get when they're young. So they don't do bottom surgery for kids. They don't do it. What they will do in some instances is top surgery, but that's for, like 14, 15, 16, I guess in that range.
They always massage the numbers to make it less uncomfortable. But no, there's also 13-year-olds having top surgery.
What they will allow, again, after consultation with experts.
Ah yes, after rigorous consultation with experts. Like this expert who prescribed puberty blockers to a 9-year-old after a 10-minute Skype session with the child.
And you can't use hormones. Now, by the way, the puberty blockers are effectively 100% reversible.
I want to point this out because it's often brought up as a talking point by those on the left. They confidently assert that it's 100% reversible. If you look on the NHS website for the treatment of gender dysphoria, that while it may be physically reversible, it is not known what the psychological effects may be. If you use the Wayback Machine on that very same page, you can see that they used to state it was fully reversible. Elsewhere on the website, they state, while it might be physically reversible, we don't know the full psychological effects of the blocker, or whether it alters the course of the adolescent brain development. That doesn't sound like we know if it's 100% reversible. Why is Kyle so confident? I thought we were supposed to listen to the experts.
Well, these are irreversible decisions that these children at these young ages...
Again, that is not necessarily true, because they don't do bottom surgery on young people. So the interventions are either puberty blockers or hormones. And puberty blockers are 100% reversible. Hormones are mostly reversible, but there can be some lingering side effects. So that's not, what she's saying there is not exactly accurate.
And you conveniently left out top surgery, which obviously is not reversible. And the irony of Kyle calling out someone for being inaccurate when confidently stating that puberty blockers are 100% reversible, when that's not known to be the case. We just don't have enough data. And that's what the experts are telling us, who we're supposed to listen to. Right, Kyle?
I don't think people approach stuff like this willy-nilly. I don't think doing medical interventions to change your gender are something that somebody would like casually do. I think that in most instances, the people who go down that path are people who are dealing with genuine dysphoria. And so to do some sort of medical intervention would allow them to ameliorate whatever sort of psychological ills they have as a result of, effectively being in the wrong body, But
this is one of my favorite Kyle Kulinski clips, because he debunks himself within a few seconds later, and it shows how untenable the position of the left is.
they don't do bottom surgery for kids. So now, by the way, if they did, I would pump the brakes and I'd be like, I don't know about that, man. I don't know if that's the best path of action. We can't say for every other thing you need to be a certain age in order to be old enough to make the decision. But for this major decision, you do need to, right? Like, that would be extreme. That would be extreme.
Wait, what? So you perfectly summed up the right's argument without even knowing it. Why are you against minors having bottom surgery? I thought they don't approach this stuff willy-nilly. Let the experts decide. You have succinctly debunked every one of your own arguments. So I don't understand why earlier he was trying to steelman the right's position when he seems to understand it perfectly well when it comes to bottom surgery. A lot of people on the right don't think that children can consent to these either irreversible decisions or decisions that we don't have a lot of data about. And you understand that argument when it comes to bottom surgery, but when it comes to top surgery, you seem to support it for no explicable reason. Bottom surgery for children? No. They can't consent to that. That would be extreme. Top surgery for children? Yeah, they can consent. That's perfectly normal. Don't ask questions. Don't even think about it.
But if you're talking about not doing bottom surgery for kids, but doing basically minor medical interventions in certain vetted circumstances.
To make that decision on behalf of the child because there's the issue of developing bodies.
I think
17, man. That's kind of...
I know, it is old. It's...
Yeah, we're not talking about an 8-year-old or anything. Go ahead.
One thing that I always bring up here is puberty blockers and hormones oftentimes get lumped together. And I think it's important to note puberty blockers have actually been used for a long time. For example, for girls who have early onset of puberty.
Yes.
And there was never the same level of concern about, what this could mean for these girls for the rest of their lives.
This is another talking point that's brought up a lot, and I'd like you guys to be able to address it if you ever come across the same talking point. The claim that puberty blockers work is based on precocious puberty. When used to treat gender dysphoria, we don't really know what happens. So don't let them get away with that certainty that they always display, as Kyle did earlier.
Hormones can be irreversible in some ways, like some of the changes that you, especially at a young age, that you go through, you can't take back, right?
Right.
Puberty blockers are a little bit different. You stop taking the puberty blockers, you go through puberty, right? So it is, I just want to make that distinction there.
Notice how Crystal's a little more cunning than Kyle. She's alluding to puberty blockers being 100% reversible without actually saying it, because we don't know. I think if you're listening attentively, you can see that she was about to say, it is fully reversible, but she stopped herself from saying it.
Right, so it is, I just want to make that distinction there.
So a couple things. First of all, I would say the detransition rate is super low in the US, which leads me to believe that the overwhelming majority of people, they start going down this path. They're not doing it willy-nilly. They ultimately are like, this is definitely the right thing for me.
Is that adults or kids?
Overall, the detransition rate I've seen is very, very low. I mean, it's over, 95% of people who end up, if they start going down the path, they continue going down the path.
Yawn, another talking point that comes up constantly that I'd like you to be able to combat, because they do assert it, like always, with such confidence that they must be correct. But as always, we don't really know because we don't have enough data, and that's what the experts are telling us. And also there's concern that taking puberty blockers can reaffirm your gender dysphoria. In other words, if you hadn't taken the puberty blockers, you might have gone through puberty normally, and your dysphoria would have been resolved. Again, we don't have enough data to know for sure, and understandably, we can't do control trials for ethical reasons.
Vetoed that bill.
What's he bought off by big trans? I don't
Well, so for instance, the Human Rights Campaign, their healthcare equality index is bankrolled by Pfizer. It's actually like a really, I think, severe conflict of interest that you have Pfizer bankrolling HRC's healthcare quality index, which takes into account things like gender affirming care, so puberty blockers, hormones. Like, that is actually a very real concern of mine, and I think.
Why is Kyle laughing at the notion that big pharma could be involved in pushing their drugs in order to make money? Is that such a ridiculous concept? One expert, David Bell, says he's surprised that the left is unwilling to consider the role played by big pharma in trans activism. Oh, but sorry, that's not one of Kyle's pre-approved experts that we should be listening to. But I think the reason Kyle's position that irritates me the most is captured in their debate with Sitch and Adam.
If it turns out, as you said, Kyle, like 10 years from now, trans regret rate explodes. I mean, everyone's going to look back at this and say, why did we allow this to happen?
Right. I don't think that'll happen. I'm saying that's what you're saying will happen, and we'll find out if it does. Right. And basically, look, at the end of the day, I think that'll more or less settle the debate, right? Like among reasonable people, they go, okay, well, yeah, so
a lot of
either didn't happen
casualties.
or it did happen, but, you know, then you'll be able to adjust from there moving forward. Anyway, we've been going for a really long time.
And that's the whole issue here. Kyle thinks there won't be an issue in the future, but he doesn't know because we don't have enough data. But the current approach is just do whatever to the children. Who cares? And see what happens. It doesn't matter if we don't have enough data. But I love how Adam deftly points out.
Well, yeah, so
a lot of casualties.
There could be a lot of casualties. But Kyle doesn't care about that. Whatever. Just let the quote-unquote experts decide. I'd like to play some of this interview from one of Ireland's leading gender dysphoria experts.
These children have been harmed and put at risk by very poor care, which has been set up by the HSE, both in the past with the Crumlin and Tavistock service, and now with a new service that they've set up with a private clinic in Belgium. And we're aware of other plans they have of equally poor care. And we've seen the result of this. We are very pro-trans people and helping them transition, but this has to be done properly, with proper assessment and proper oversight. They've not been listening to us for years, and they've shut us out. And instead, they have brought in people who have no clinical training and have an ideological approach to this.
But yeah, don't listen to that guy. He's the wrong type of expert. He's not the pre-approved type of expert. And he was referencing the Tavistock Gender Clinic that was rated inadequate for not following their own procedures and rushing children to transition therapy. And it's this ideological approach from people like Kyle Kulinski, when they deny any of the valid uncertainty and concern there is around this type of therapy, that allows them to rush children into treatment that we could find out will be a disaster in a couple of years. I just wanted to say again, happy 2024. And thanks again for all the support you gave me throughout last year. All the nice comments helped me stay motivated and keep progressing.